quickly, our midnight census was 382. Again, we're going to phase out our Bryan Easy visit reporting, but it's still active and live, so we'll do that at least for one more day. Screening visit questionnaires that have been completed are now at 12,410, resulting in 4,253 easy visits, and 2,010 people use the COVID promo code. And then before I get into the numbers, I know everyone's trying really to reconcile the numbers. There's the ArcGIS interactive site that has kind of been the backbone for the Johns Hopkins reporting that most of us have relied upon. We know the health departments throughout the state are reporting by county. Then you hear from the governor, then you hear from the mayor. Some states' companies are reporting their findings. And then there's health systems like us that kind of cross those county boundaries. So I know that timing's an element of this, and it's clear as mud to most of us. So I'm going to be just a bit more granular because I know some of you guys are tracking stories that are happening in Saline County, and maybe this will give you a little bit of insight. So overall, we have now administered 4,762 tests at Bryan at one of our locations. Our positives are now at 588. 3,723 negatives, and there's a big pending amount right now. There's 451 pending. But where I'll break it down a little bit further, the mobile unit, or mobile screening unit, is the last one that we set up. As of now, it has only been in Saline County, and what the mobile unit has tested, they've administered 338 tests with 115 positives and 223 negatives. Don't know if they were all Saline County residents going through the mobile clinic or if there were Lancaster employees that went through that. We don't have that, but it gives you a little bit of maybe more from our 588 positives. 150 have been at the mobile clinic, and the mobile clinic has only been in Crete, Nebraska at this point in time. I'll invite John up, and then we'll have Dr. Johnson.
Thanks, Bob. Give you some good news. Our positive COVID patients in-house is down to 20. So some folks were discharged from yesterday. We have 7 of those individuals in our intensive care unit, 6 are in our progressive care unit, and 7 in our general care. 6 of those individuals are still on ventilators. Bob mentioned the pending number, so wanted to let you know we did a number of tests the day before yesterday. About 330. Those results will be coming back today. So we anticipate that number to decrease by quite a bit, but also at the same time, you'll probably see the positive number increase just due to the number of tests that was administered then. And then as Bob talked about the mobile unit, and we've shared with you today, it will be at the Crete location again. We'll be there for roughly 1 o'clock in the afternoon till 5:45. And we would anticipate seeing some pretty high numbers again around Saturday or Sunday when those results come back. With that, I'm going to turn it over to Dr. Bill Johnson.
Hello, I'm Dr. Bill Johnson. I'm coming up here with my mask on for a purpose, and I'm doing exactly what Bob and John just did off camera, and everybody else in the room is having a mask on, and I'm showing you how I take this off and set it on a piece of cloth. I was asked to talk a little bit about safety for the public, and I guess first thing I do want to say is to the community of Lincoln and Nebraska as a whole, but the way we've talked about flattening the curve, and yes, you did, and you ought to all be tremendously congratulated by that. You've absolutely saved lives by doing this. You've allowed us the opportunity to do what we do and actually allowed our hospitals here to take care of other communities and be prepared. And for that, we thank you. We have to think about other strategies because you've all put forth an effort, made sacrifices to allow this to happen. And we want to take what we've learned because we have learned some things over time. And we want to share that with you to help make this as safe of a process as we can. I've talked with Dr. Jocelyn Herstein, who's a public health infectious disease specialist, and out of Nebraska Medical Center, and we've had some discussions about this, and the absolute key to this whole issue is the asymptomatic carrier. And the real issue that we're facing is a person who feels well, who may misunderstand the fact that they're a carrier and unwittingly transfer disease to other people when they don't think they have. And unfortunately, when that happens, the cat is out of the bag, and that's part of what we saw happen. And as we try to do things like tracking down cases, case tracking, I believe they call that, those things work and help, but it's very helpful to try to stop this from the very beginning. Herd immunity is probably more considered a catastrophe and not really a strategy. I don't think that the initial thought where there was going to be a certain number of people get infected by this no matter what is necessarily true. Yes, flattening the curve is important, but I also think that there should be a goal that maybe we try to reduce the number of people who get ill as much as possible until we can get a real game changer that comes along, such as a vaccine that may really help us change what happens. For those of you that have had this, for those of you that have had a person die of this, to you, and that person, the mortality rate's 100%. And that's what we feel as your care providers. We take that to heart. We don't want to see deaths. We don't want to see people get ill. And we don't want to have the fact that, well, our hospital is doing okay, so, well, let's let people get sick. We don't want that to happen either, nor do any of the people that are leading this and leading us going back into our economy starting up. They want this to happen as successful and as healthy of a way as we can. And because all of you have helped us, we've thought, how can we help you? The Lancaster County Medical Society and I know the Nebraska Medical Association are going to start putting out some word on this, a physician campaign, if you will, to help you understand what it means to truly protect yourself, to self-distance, what that really means. And I think to start off with here, the hand washing, don't forget that. And I always tell all my patients, protect your home. When you first come in the house, wash your hands when you first get in the house. Get your house all wiped down. Anything you bring in there, you wash off and you have your hands protected. Get your house a barrier around your home so that you're safe. When I come home to my wife at night, I take off all my clothes and go get in the shower and throw things in the laundry. Washing your clothes if you've been out in public is a good thing to do, and certainly for anybody who's exposed. Hospitals have done things, and we've done things to protect ourselves and to protect our patients through the years. And there's a term we call universal precautions, and it means a lot of different things to us, but I'm going to use it in this circumstance for all of you. That's really what we have to look at. If we're going to stop that asymptomatic carrier, we have to have universal precautions. And if you look at, we have a graph up here that shows two people that are not wearing masks. And if you have someone who's a COVID carrier and they're unwittingly thinking that they're healthy, the possibility of transmission to another person who's not wearing a mask is very high. And I would remind all of you, yes, the hand hygiene, standing 6 feet apart, all those things are important. But remember, this is a respiratory disease. Where do respiratory secretions come from? They come from your mouth and your nose, and they're expelled into the air. And so somehow, some way, we have to help control that. In the past, we've done things such as the provider wearing the masks, the person who wants to protect themselves. And if you look at the next slide, what we have found in this illness, that doesn't necessarily work so well. When I'm wearing a mask, I'm not really protecting myself that well. There's actually a pretty high probability that there can still be transmission. And for those of us in the medical field, we talk about things like droplet and aerosol, and I'm not going to get into that. Just understand that the person wearing the mask isn't really trying to protect themselves. They're thoughtful and thinking about it, but if a person is an asymptomatic carrier, then that person can still transmit that if they're not wearing a mask. Interestingly, if you turn this around and you go and you find that a person who is that asymptomatic carrier and they're wearing a mask, we drop the rate of transmission dramatically because those aerosolized and droplets are not getting through. Now we know and we understand and we concede the fact that yes, an N95 mask is great. And maybe on the prior slide, if you had an N95, maybe you'd do a better job. But we understand that these masks are not all available. Procedural masks for hospitals are not all available. But still, even the CDC has stated that use the best you can. And cloth masks that are homemade are things that can be useful and helpful. And there's actually things on the CDC website on how to get these. The Lancaster County Medical Society and Nebraska Medical Association, we're going to try to get the word out to try to get masks available. I think honestly, until COVID goes away and we get a vaccine, and perhaps the day when loop masks like this one can become available, the one that I was wearing, maybe you'll find those on the same aisle as you find your personal hygiene products and your toilet paper. That may be the way it is until things normalize out for us. If you go even one step further, and both people wearing a mask, I don't want to use the term N95, but boy, there is tremendous safety in two people wearing a mask. If two people in a room are there and one of them has COVID and they both have a mask on, there's still tremendous safety, and the likelihood of passing that on is dramatically reduced. I can't give you numbers. I don't think anybody can give us numbers, but we've seen numbers as low as less than 2% on those that when there is both people wearing a mask. We've heard times where people have said, what could we have done in the beginning to help prevent this? And to Nebraska, I'm pleading with you here, now's our chance. Now's our chance to make that difference as we move on. There was a scenario in Washington where a choir got together and 60 people were in a room and they did all the social distancing that they were told. And they practiced their choir. Granted, they were singing and you could make statements about that, but nobody had on a mask. 45 got sick. I believe 2 died just because they went to choir practice. And if they were to go back, if you were to ask that group of people if they could have all put on a mask and done what they did, there's not a physician out there that wouldn't say that outcome wouldn't have been dramatically different than what it was. Our chance is now. I have 3 kids. I don't get to see them. They're all in various universities across the country, and when we say goodbye to each other, we always use this sign. And it means love, but it means a lot of things. And when you're a parent, it means study hard. It means be careful, drive safe, take care of yourself. And it means I care about you. To those out there, I know there are people who don't want to wear a mask. I know there are people that are willing. I'm pleading with you. We have to take care of each other. Think about your neighbor. Think about your family. There's businesses who want to start. There are people that want to work. They want to do it safely. To do that safely and to make it so that you're getting a paycheck 6 weeks from now and you're not quarantined because someone gets sick, I urge you to take care of yourself and be safe. Think about those things. Think about other people. Show other people that you care. It's vital that we do this for each other. Wash your hands. Be careful. Stay your social distance. Wear a mask. Tell people that you care. Thanks. And I'll go one more point. When you take this up, I want to make a point with this. When I took that mask off, I set it down on a piece of paper so that I didn't contaminate that. I picked it up by the ear loops, and when I put it on, I don't touch the front, and I put it on. It's important not to touch the front. It's important not to touch your face. That's how this gets spread around, is when you touch other things and touch your face. Always wash your hands before you touch your face. Again, like I said, be safe. Thanks. I think that we know that the people in charge are trying to make the best decisions they can. They're looking at the things the best way they can. We're trying to help give them the guidance of doing this. And as we loosen restrictions, we want to give people the best opportunity to make the best decisions possible. and as I leave some of those decisions to our mayor and our governor, I know they're trying to make those best decisions. We're trying to guide them as well as we can. I think, clearly things like the restaurant business, where how do you wear a mask in a restaurant when you have to eat? And we recognize that, and we have ways that we do it here, and there's ways to share the safety there. We also know that that there are risks out there of getting people together, but if we do it as safely as possible, I think those numbers, if we can keep it way down, we'll be happy, and we'll learn more as we go along. And as we learn more and find ways to keep people from getting this, we'll certainly share that with you. Thanks. I've seen that there is a rise in that. I saw something in the news about it. My daughter's in her pediatric residency, and she's commented about it. Right now, I don't believe we've seen that here at Bryan yet. I'm guessing a place to find that would be children's. I think where it's real heavy, places like New York, that's the place where they're seeing it the most. And I've heard there's somewhere around along the lines of 60 to 80 cases there. So that's another thing to keep an eye out for.
Not really. The telemedicine has been a great assist in that, and I know when I've spoken with Dr. Johnson, he said there's a greater acceptance of the use of telemedicine, and they're using that where needed. So I wouldn't say it qualifies as skipping appointments, but they're certainly being done in different ways right now. Disinfectant wipes was the only thing that was still really kind of tenuous, but the gowns that we've talked about in a great amount around here is in what is called the limited category, but not a critical measure for us right now. So those things have released, but our supply chain people, it's like a bare knuckle fight to try to find this stuff and get it, and they're on it every single day. Monday, Wednesday, and Friday we have what we call our pandemic meeting, and it includes physicians, leaders throughout the organization for a touch base, and this is something that is reported on every Monday, Wednesday, and Friday to keep a handle on it.
It seems that sunshine does work, but again, this is not necessarily thought to be a seasonal virus that we know of yet. Part of the issue is that nobody has immunity to it, and it's new, and it's terrible. The disease is horrible and horrific when I see these people that are deathly ill. And it'd be great if it would go away, but I don't know that it's like the flu virus necessarily is. I think certainly risks of being inside are greater than risks of being outside, kind of like the secondhand smoke idea. But that doesn't mean if you're outside that you shouldn't wear a mask. Continue to be very cautious outside. I even saw on one of the news shows, I think it was Good Morning America, where a physician was still recommending that you do some type of mask if you're going to exercise even outside in an area where there may be a large number of people. So those are cautions that we still have to take.